Afternoon, everyone. I'm going to present to you a scoping review we've conducted, and just to give you a little background on the project, telephone consultations are increasingly being used in primary care. Within GP consultations with patients over the telephone, video conferencing, and the project came about driven by physiotherapy services, but there was a lack of evidence around how to conduct. We were looking for best practice of how to do it, and kind of came at the very start of the project that there didn't seem to be much out there for us, so the scoping review was then identified as the best way to map the evidence for us. In terms of allied health professions, we have a standard in the UK that for our one-to-one consultations for patients, we should be able to deliver them in the appropriate time frame, but actually using different methods. So it can be face-to-face, it can be by telephone, or it could be by video. And the project overall was driven by the NHS Musculoskeletal Physiotherapy Service, and our overall aim was to explore patient and physiotherapy perceptions of the outpatient service with telephone assessments to inform the design of a training programme, because we'd identified that there wasn't one out there. So I'm presenting you the scoping review part of the overall project, but it did then go on to inform the qualitative interviews and the expert working group section in the project. So using a JBI protocol a priori that was published, we had our inclusion criteria PCC for participants was any qualified healthcare practitioner. We weren't limiting this just to physiotherapists. We were interested across in primary care and what is happening in healthcare for this service. But the concept was about initial telephone consultations. And the context was primary care predominantly. We weren't looking at any other area in healthcare. We had a 3-step search strategy. We limited it to English due to funding restriction. We didn't have any translation costs built in, and our search frame was through from 2002 up to 2017. So our initial search was Medline and Sinal with key terms. We then, at stage 2, went to 7 databases for searching, but as with a scoping review, to ensure we identified all the available literature and evidence, we included 9 countries with their Department of Health websites, and we also looked at the professional bodies in 40 professional bodies globally to identify if there was any source of evidence within their professional framework. And then stage 3, we then reviewed the reference list to ensure that we had identified all available evidence. So quickly into results, just like that. Doesn't happen that quickly in real time. We had over 3,000 hits of sources of evidence, and after deduplication we were down to 3,000. That went through title and abstract screening. We included 99 sources of evidence at full text, and eventually had 18 sources included in our full review. And of those 18 studies, this included 144 healthcare practitioners, but predominantly covering nursing, AHP and medics, which we kind of expected. Across the board, we had groups of patients which ranged from 55 to over 1,500 patients included. And there were 5 countries that the evidence was sourced from. So the UK, Netherlands, Australia and Denmark, all within primary care settings. And the majority of the information that we found was actually from text and opinion. So it was unpublished sources. We had about a third of that over 3,000 sources came from published peer review studies, and over two-thirds of the information came from the unpublished sources. So it was very time consuming to search for that, but it was the bulk of the evidence for the scoping review identified. And from the studies, or the sources of evidence, the extracted data was then synthesised into 3 findings, which formed from our objectives of the 6 components, 7 skills and 7 training requirements to conduct an initial telephone consultation, which gives you a nice a lot of work comes down to one one slide. It's, in a way, it did look like what we expected, but there were elements that came through from the evidence as well that we hadn't expected. But in terms of the components you need to do a telephone consultation, you have to think about how to start it. How do you begin your assessment? You have to think about the timing of it. What documentation do you need? What assessment methods are you going to build to this telephone consultation? And the subsequent actions. What happens at the end? Where do you go? Do you refer them on? Do they self-manage? Do you send them things? Do you take them in for a face-to-face consultation? What do you do? You have to think, and is thinking about that type of components within this telephone consultation. And there's legal requirements within that too. Then the skills that the practitioner actually needs were the key clinical skills actually that we need as clinicians. So the communication and listening skills, our empathy and rapport, standard practice. Clinical experience was coming through, that we needed a bit of experience in there, and evidence-based practice, and an enhanced skill set to deal with the non-verbals, that you are just dealing with them on the telephone, you are not seeing face-to-face any background, which is a slight shift to what we're used to as clinicians. And again, legal skills, we needed a little bit of thought around that. And then in terms of training, so to train someone to then do telephone assessments, you need to train them to make sure that their skill set is enabled to do that. And for clinicians, it was fed back that they could be quite anxious about doing telephone consultations due to the lack of seeing the patient. Then the package, the observation period, so we observe our clinicians while they practice, or they observe an experienced person. The competency assessment, thinking about how do you then check that they're competent to do it. That needs to be taken on board in the package. And also thinking about training elements across undergraduate and postgraduate so that they can come through, that they don't need as much training, that they can arrive as experienced clinicians with that skill set already there. So at the end of the project, we've mapped that evidence for it. And we've now taken that forward, and it informed the training package alongside the qualitative interviews with patients and clinicians. And it was lovely to pull that together, that we've now got a kind of a model of the best practice to do telephone consultations, which we're now writing up to report the full study. And I'd like to acknowledge the financial supports, the supports in conducting the review, and our co-authors within clinical practice. Thank you.
I think it's great actually this afternoon we've had examples of different review types, so this is a really nice illustration, of the utility, I think, of scoping reviews. So yeah, well done, that's
thank you.
Nice presentation. So any questions relating to that, to the methodology or to the findings?
Thank you. I would like to ask you about primary care. What do you mean under this? Because I'm not sure if it is a country specific, or do you mean outpatient healthcare providers? Or
outpatients, anything
what
that
was
takes
included?
place out with the hospital setting. So not the acute care service within hospitals. So it would be your outpatient services and your GP services, and if everything happening within the kind of, not within the main hospital setting. I can't remember the right definition. You remember the definition, Kay?
No, I can't. But basically, some hospitals, community hospitals, are considered primary care in the UK.
Yes.
So secondary care is like acute. So, you know, emergency admission.
The large
surgery,
hospitals.
All the rest of it, whereas anything kind of under out in the community is considered primary care.
Yeah.
Primary care is first contact. It's first contact care. It's patient's first.
Yes, but yes.
That's better.
Yes. Yes.
But I'm from Slovakia. From
Yes.
our point of view, primary care, I would cover GP and maybe gynecologist. This is like in our country primary care, because that I'm asking that you
Yes.
that the result was about 5 countries.
Yes.
So if this could be something that primary care is something different in different countries, or yes, this was my question.
I think
about
within the search strategies, though, we were looking at health professions and telephone consultations, and so it was when it came down to the definition of primary care, we were looking at this. You know, that was really at full text, looking to ensure, because primary care is it's not always explicitly said. So we're looking at where the setting of the studies were undertaken. But actually, that was the small bulk of the literature, because it was about the unpublished literature search. Purely because there's not really a lot of there's studies, I suppose, about the impact of the effect of the doing consultation, but not so much about how to train someone to do it and how to do it. That often becomes, that's more processy, so it tends to not be as evident in the literature base, because it's not the bigger topic, I suppose, in publications. So I suppose it's very hard to give you the full review.
I was
And
just
a very
surprised that
tight.
physiotherapy is like a primary care. For me, so that's my question, what it is.
Yes. Yeah, thank you.